So one of the big topics of discussion within our community the last week or week and a half has been the news report of a possible association between the use of semaglutide and blindness, a specific type of blindness known as non-arteritic anterior ischemic optic neuropathy, or NAION. And it's important to point out at this specific point there is no associated cause between the use of semaglutide and this specific rare condition. There is a correlation, but that correlation could be tied to numerous things that users of semaglutide may have also, and may be the reason why they're taking semaglutide: for treating type 2 diabetes, for being overweight or obese, which may lead to a condition known as sleep apnea, where you stop breathing at night. It could be tied to high blood pressure and the use of medications to manage your high blood pressure and taking those medications at night. I listened to a podcast called Docs Who Live, and they recently had a guest on who is a retina specialist and a doctor of ophthalmology. His name is Jonathan Ruger, and they had a great discussion regarding this study and how poorly done it was. And they talk about some of the mitigating factors that can lead to getting NAION. And what Dr. Ruger points out is that this condition tends to happen while people are asleep, and it happens because their blood pressure drops while they're asleep, and that can maybe tied to different conditions. So what happens is that their optic nerve strokes out due to lack of blood flow, and they wake up and there is a perfect horizontal line in one of their eyes, and it's straight across, and then everything either north or south of that line is blacked out. You can't see anything. So you may see everything north of that line, but you won't see anything south of that line, or you may see everything south of that line and can't see anything north of that line. And he says what he does is he looks for when people have a tight optic nerve, because that can show, or that can lead to lack of blood flow. And he also assesses the patient's history. Do they have sleep apnea? And is that sleep apnea being controlled by the use of a CPAP machine or some other device? Do they snore at night when they sleep? Because that may be an indication that they have sleep apnea, and they stop breathing at night, and that causes their blood pressure to drop. Are they currently using blood pressure medications and taking those before bed? Because that could lead to their blood pressure dropping while they're asleep. And is there an indication of dehydration? Because lack of hydration can cause your blood pressure to drop while you're asleep. So what he says what he does is if he has someone who is on a blood pressure medication, what he would do is change the timing of when they take that blood pressure medication, so they're not taking it before bed. So he'll move them to the morning or sometime during the day to prevent that blood pressure drop at night. And something to be aware of within our community itself is when we're taking these GLP-1 medications, we're losing weight, which can lead to the lowering of your blood pressure because you're treating the underlying condition of obesity and cardiovascular health. The medication itself may lead to a lowering of your blood pressure in conjunction with the weight loss. So if you're on a blood pressure medication, it may be a good time to talk to your medical team about lowering your dosage, changing the timing of when you take that medication, so you're not taking it before you go to bed, and also possibly going off. I know there's numerous people within the community that have discussed being on multiple blood pressure medications and cutting those in half, and then completely stopping the use of those blood pressure medications, because their blood pressure is well maintained and managed through the loss of weight and the use of the GLP-1 medication. And if you're a sleep apnea patient, make sure that you're using your CPAP machine. If you're snoring and stopping breathing at night, make sure that you get a sleep study so you can start the use of a CPAP machine to provide pressure to keep your airways open and your blood pressure up while you're asleep. Again, those are all things to talk about with your medical team. This is not specific medical advice. But if you get the opportunity, I would highly recommend that you go check out that particular episode. The podcast itself in general is really good. They focus heavily on GLP-1 medications. I think one of them was an endocrinologist. Later on in this episode, they also talk about diabetic retinopathy, so that may be something that you're interested in. I will post the link to this specific episode in the YouTube video description if you want to check it out. I'll also post a link to the news story so you can read about yourself. I won't go into the numbers because I won't do it justice, but it's just something to be aware of, not something to be fearful of at this time. There's things that you can do to mitigate it. Talking to your doctor will help that, and listening to this podcast will give you insight to have those specific discussions with your medical team. So I hope this helps someone out to ease their fears and to get necessary medical help from their medical providers to mitigate your risk of developing NAION. Hope everyone has a great day. I'll talk to you later.